Let's talk about where we have very little hope, and that is the NHS being reformed. Wonder why? Well, MPs on the Public Accounts Committee have a pretty good idea. They have issued a report today saying that the NHS is run by bureaucrats who they say lack ideas and are obstructing the reforms needed to fix it. The committee, which is headed by a Tory MP, Sir Geoffrey Clifton-Brown, but is a cross-party committee, has said that the government's ambitions to overhaul the health service represent a golden opportunity to improve care, but the bosses aren't willing to make the necessary changes. And basically, they said the systemic issues plaguing the NHS, and they said we were aghast to find among senior officials in charge, and they've interviewed all of them on the committee, in charge of delivering these ambitions, some of the worst complacency displayed to the committee in their time serving on it. Well, let's talk about this with Dr. Laurence Buckman. He's a GP and former chair of the BMA's GPs Committee. Very good morning to you, Laurence.
Morning.
It's very interesting. So I've been saying this for years. Actually, the biggest problem, it's not, the work of the NHS doctors or nurses. It is the people running it. It's the Department of Health Permanent Secretary. It is the Whitehall civil servants. Crucially, it's also, the chief executive of the NHS and a huge number of bureaucrats. This is what the MPs are saying.
Yeah, they're right.
Simple as that. They're right.
Yeah. And there are good examples of what happens if you ignore the lead weight in the NHS. The best example is one you and I have talked about many times, which is the COVID response, where out of nowhere, they created an entire division of the NHS to deliver COVID care for the entire population. It must have cost a lot of money, I'm sure, and I was one of the doctors working for it. They recruited hundreds and hundreds of doctors who are retired or just retiring. They enabled IT that would never happen before, where everything joined up with everything else. It was easily doable. And what happened was they had very good, wise management who got on with it and made change happen.
Can-do people, yeah.
Yes. And they did the whole thing. And yet we seem to be unable to do that in other contexts of the health service.
Yeah.
And some of that's to do with recruitment and retention of staff. We have nowhere near the kind of workforce to deliver what people quite reasonably expect of a health service.
But a lot of that is down, A, we don't train enough people, and B, a lot of people don't want to work in the NHS because it's so demoralising. And that's down to management.
I'm afraid so. I work in part of the NHS that sends me a birthday card and a Christmas card and is nice to me. And when I phone up the office, they say yes. Whereas no other part of the NHS I've ever worked in did that. That kind of behaviour only has to be translated and costs almost nothing and would make the most enormous difference to retention.
Yeah, well, just people feeling valued, but also people feeling they can do the job they want to do to their highest ability and treat the patients and not be, people not getting the care they need or arriving, at A&E, for instance, and not getting treated for hours on end or even days on end. I mean, this is the thing. Whenever I've seen Amanda Pritchard, the NHS chief executive, being interviewed, I'm just like, how anyone thought this woman was up to this job is an embarrassment. For a start, she's told a blatant lie about, COVID patients on wards, which should have been a sacking offence. Something that she quite deliberately lied about a couple of years ago, which I thought was incredibly damning of her. She's a sort of a lifetime, NHS employee, bureaucrat. We know that bureaucrats get hired and fired. They get rid of some, they rearrange the deck chairs, and then these same people are brought back with their big redundancy packages on more money as a freelancer consultant. It's a gravy train what's going on in the NHS right now. But there's no evidence that a lot of these people are really any good at running hospitals or running a healthcare service.
Well, that's not because that's not their primary job. Their primary job is to save money for the government.
They're not doing that either.
No, they're not. No. And it needs original thought. It needs people who will get on with it. If we could do it during the pandemic, we've now got a different problem, which is we've got a huge number of people who are not getting the care that they need.
Yeah.
No doctor is proud of that because it looks terrible. And I wouldn't want to be treated like that if I were a patient, which, of course, like everybody else, I am potentially. Yeah. And we need to have the wit and enthusiasm to engage the workforce and to engage everybody within the NHS, even not the frontline people, to actually saying, we can do it. And I'm afraid, I'd love to say the MPs are wrong, but they're not.
No, exactly. But even down anyone who's had any experience, I mean, I'm always just amazed. Just booking, I don't know, booking a mammogram, or just like I've just had an appointment which has been made for me. Like it was 3 or 4 months' notice. I got 3 notices yesterday. Amazingly, I got them on email. Didn't have to wait for a letter that was then superseded by another letter that was already out of date. So moving the appointment by a month, telling me that I've cancelled the appointment and moved it. I haven't done that. I'll be penalised if I had. I mean, it's just just abject incompetence in the bureaucracy, which I think is what breaks a lot of patients' souls as well, and I think is at root of a lot of the problems. But I mean, again, I just don't see how we're going to reform the NHS with so many people who are at top-level jobs, paid, by the way, very big 6-figure salaries, who clearly have proven themselves not to be very good at it. Not least for the fact that you say, well, they did well treating people with COVID during the lockdowns. Yeah, that was in return for not treating anyone else. We were the only healthcare service in the world that did that, and people have died. Much younger people than those who were dying of COVID have died as a result of that. And again, I think people should be going to prison for that, let alone being made redundant. But, I'm old-fashioned. I think healthcare services should be there for everybody. Thank you so much, Dr. Laurence Buckman. Thank you for that. Candice, I mean, look, you've had a lot of experience with the healthcare, all these babies and the like. I mean, what do you make? What do you make of this MP's committee report?
Yes, well, my experience of maternity care is absolutely appalling. It's the worst. We've had inquiry after inquiry after inquiry. Something needs to change.
There's a reason why more mums and babies die here than in comparable countries.
And it's also just the most miserable experience. Most people will tell you going through maternity care is just the worst way to start parenthood.
Mine was 18 years ago and I was drugged out of my soul. I've never done drugs before or since, but God, that was fun.
But I would recommend that.
Yeah. Legal drugs, when in birth, when in labour, absolutely.
Get it all. But I think you're so right. More scrutiny needs to be applied to the management of the NHS. I've always said it. Why does no one hold the CEO, Amanda Pritchard, more accountable? If this was any other company, if this was a private business...
If she was running Tesco, she'd have been sacked long ago. Utterly unfair. I just think you have to have a massive sweep out. Have them reapply. I mean, but I want them to bring in someone. I've always said, bring in someone who can do logistics at Tesco. That is the person I want running the NHS. Because it's the logistics job board. They're not the people delivering injections, for goodness sake.